Right.
Welcome, everybody. I'm Joya Goodrum with the McMinnville Chamber. I'm so happy to see all of you here today. As part of our business support series, we have invited Paloma Sparks with the Oregon Business and Industry to give us an update on the new OSHA rules that we anticipate might be initiated and we're going to have to live with for a while. So I'm going to turn it over to Paloma. Just a reminder, please put your questions in the chat. We'll get to them at the end. And everyone is muted, so we won't be interrupted. Paloma has a presentation, and I'm going to turn it over to her and turn myself off. And I appreciate, Paloma, thank you so much for being here today. I look forward to hearing more about what's going on. Thank you so much.
Yeah, happy to. I'm going to share my screen, which has a PowerPoint presentation. One moment. Okay. So, again, I'm Paloma Sparks. I am the Vice President of Oregon Business and Industry. I have a background in employment law, so I'm heavily involved in anything that has to do with Oregon OSHA, the Employment Department, Workers' Comp, Bureau of Labor and Industries, and any sort of related legislation that happens at the legislature. So I have been tracking all of this legislation, all of the rulemaking around Oregon OSHA, have been submitting very detailed comments. Also on the Oregon OSHA has a sort of advisory committee that is called the Partnership Committee, and I'm on that committee. I'm also going to be on the Permanent Rulemaking Advisory Committee. So I'm just going to try to, as quickly as I can, but with sufficient detail, run through what's in the rules, and then hopefully leave plenty of time for you all to ask questions. Now, we just got this latest draft of the rules on Tuesday. So, you know, this is the third draft of the rules. So I'll sort of go through how we got here. Back in July, I believe it was, proposed legislation was introduced that would have had us on a way too tight of a timeline to ever accomplish. OBI opposed that legislation. We thought we were done having that conversation, and then we found out that Oregon OSHA was going to do this rulemaking. So here's where we are. So this is going to be a temporary rule, which means that it will be in effect for 180 days. After this temporary rule goes into effect, we will then sort of almost immediately launch into permanent rulemaking to have a conversation about what permanent rules might look like. Michael Wood, who's the administrator for Oregon OSHA, has indicated that some of the permanent rules won't be needed. Some they will have for when they need to do rules if there's another sort of infectious outbreak of some sort. So these temporary rules are going to be COVID specific. Permanent rules likely will be an infectious control standard sort of generally. So we saw the initial draft on September 17th. Then we got another draft on September 25th. We just got the most recent draft on Tuesday, October 13th. The division plans to adopt the rules October 21st, and then they will be effective November 1st. There's a couple caveats on that effective date because they've built in some sort of implementation phase-in dates on a variety of the pieces of the rules. So distancing, I think most of us have been working through all of this already, but you need to make sure that all employees are maintaining 6 feet of distance and that they can accomplish their work tasks with 6 feet of distance. This obviously can be challenging depending on what kind of work environment you're in. So if there is ever a chance that you can't maintain that 6 feet of distance, you need to make sure that there are masks. It's unclear at this point, since the division has made so many changes, how barriers are going to come into play. We've been told that they're going to do some additional language about this, but their initial language was far too confusing to be helpful to any employer. So a new thing in the latest draft from Tuesday, the September 25th draft said that in vehicles, you were limited to half the vehicle capacity or no more than 2 people, whichever was greater. They've added some new language that says if everyone in the vehicle is wearing respirators, you can increase that number. So you're not stuck at the 50%. As long as everyone has respirators on. And respirators in the world of OSHA are, N95s are considered respirators. There's a number of other ones. They have specific rules. There will be an appendix in the rules about that. Also, if more than 2 people are going to be occupying 200 square feet or a room that is less than 200 square feet, everyone needs to be wearing face coverings. So we've covered a bit about the face coverings, but always in vehicles, anytime that work duties are going to require that people come closer than 6 feet, they need to be wearing masks. At all times in retail, at all times in restaurants. There's a number of industry specific rules that are in the appendices to the rules. Employers are obligated to provide the face coverings. There is new language that seems to disfavor the use of face shields. I'm hoping to get some more information about sort of where they're going. That generally is coming from CDC recommendations that say that face shields are not best practice. So employers are also expected, and OSHA for retail has been enforcing this quite aggressively, so just be careful. Employers are expected to enforce the requirement for anyone who comes into your workplace that they all wear face coverings. You're going to want to post lots of signs. You're going to want to, I strongly advise, stock up now. If you feel like your workplace is likely to need masks, get them as fast as you can. So OBI has really been pushing on the Bureau of Labor and Industries, Oregon OSHA, and the governor's office to get some clear guidance about what we do when somebody says that they have a disability or a medical condition that prevents them from wearing a mask. We're getting a lot of folks, especially in retail, who say, I'm not wearing a mask because I have a disability, and then we run into these conflicting agencies and conflicting law problems. So on sanitization, you are expected to sanitize, and by sanitize, the department means clean. So a regular cleaning, it doesn't have to be sort of high tech, but sanitize high touch surface, common areas, and shared equipment. This is a new change that we got in the last draft. Is it has to be at least every 24 hours for spaces that will be occupied less than 12 hours a day, and every 8 hours for spaces that will be occupied more than 12 hours a day. This is definitely an improvement from the initial draft, which had us doing it between every shift, which gets very challenging when you've got overlapping shifts. Building operators are also expected to sanitize and clean any common areas and sort of shared spaces that they control. Ventilation, they want us to make sure that we are maintaining and replacing HVAC filters, make sure the vents are clean, optimize airflow. Essentially, you just want that air to be moving as much as you can. Thankfully, the division has recognized some of our concerns, which is We just have to maintain up to the manufacturer's recommendations. They've also given us some more time to have this done. I've told them, you know, there are some real concerns about us being able to get service providers, especially if you're talking about small businesses. We don't have staff to maintain our HVAC systems. We got to get somebody to come out to do it. Now, for the healthcare industry, this is going to be a really tough one, because for healthcare specifically, they're requiring in the latest draft 12 air exchanges per hour. When you're talking about a large hospital, that's probably fine. They can probably manage that. Well, no, let me say this. Hospitals can manage 6 air changes an hour. That's sort of standard right now. 12 is going to be tough. All of those other folks that got sort of swept into healthcare, it's going to be really challenging. So we have pointed that out to them. Whether or not that's going to make a huge difference, who knows? The previous drafts all required that we have a distancing officer, which a lot of folks have done. They just name whatever the employee is who's most likely to be sort of maintaining the office space. And they made that person a social distancing officer. That's not a requirement. I would recommend that you at least have somebody who is in charge of making sure that you've crossed all the T's and dotted all the I's on implementing these rules. So more recent requirement is that every employer conduct an exposure risk assessment. So OSHA has provided questions. They'll also provide a template. And if you have more than 10 employees, the exposure risk assessment must be written. For your safety, I would probably recommend that everyone do write it down, or at least sort of maintain a copy that you've done this. So the exposure risk assessment has a number of requirements. It wants you to analyze whether or not you have work from home options, what are the distancing requirements for how people will do their jobs, how are you going to have face coverings, how are employees going to report symptoms or infections, what's the status of the HVAC system, how are you going to control the space, so, you know, changing traffic flow, that sort of thing. How are you going to sanitize what needs to be sanitized? And then how are you enforcing sort of industry specific requirements? And if you're in a sort of a large office building, how are things being negotiated between employers? A new element to this that I have some concerns about is the requirement that you do everything you can to sort of minimize the room for employee error. I've been pushing back with OSHA about this a bit and saying, you know, at some point there has to be an expectation of personal responsibility, and employees need to be expected to follow these rules just as much as employers are. Then a brand new requirement that came on Tuesday is that all employers must have an infection control plan. Essentially, the infection control plan is how are you responding to the questions you've discovered in the exposure risk analysis or assessment. So how are you going to keep folks safe? How are you going to keep them separated? What's going to be the policy about face coverings? Who are the jobs that you've sort of done an analysis on? We're still working through some various details around this, so it's not completely clear what this part will look like. But you know, it's also sort of, if you have multiple sites, how do you work that? That sort of thing that we're still working on. No, the actual plan doesn't require employee feedback, but there's another element about training that requires that you engage with employees in the training, which will essentially, you'll be training your employees on the infection control plan. So it's sort of a difference without a distinction, or a distinction without a difference. This also has delayed implementation. We don't have to have this done until November 21st, largely because they recognized there's a lot of complexity. There's a lot of questions to be answered. We don't know when OSHA is going to have the forms done. A new one is also, if we know that there's an infection in the workplace, or there's somebody who was suspected to be infected and was in the workplace, employees must be notified within 24 hours. And my advice is make sure that you are doing everything you can to protect the identity of the individual who is infected. So you're going to want to use very general terms. You may have been exposed. Don't identify the job that the person did if you can. Certainly don't reveal their name. Try and avoid identifying characteristics if at all possible. Then on medical removal, the current draft is actually drastically improved from, we've progressively improved this section. That's my good news for you. Originally, this was requiring us to provide paid leave. That's no longer the case. Previous drafts also suggested that we would have somebody isolate at the workplace. That's not best practice. It puts us in a bad spot. We don't want to do that. So now the employee must either work from home if that sort of work is available, or they will just be on unpaid leave or could use existing leave that they have available to them. There is a fund that was created by the state using CARES funds. So an employee could apply to get sort of a wage replacement if they have to go out on leave because they have to quarantine for some reason. Employees are entitled to return to previous job duties if those are available. We're still working through the issues with OSHA of understanding what it means when, sometimes the job's just not going to be there anymore, or the previous job duties were destined to change anyways, that sort of thing. And then there's also the retaliation protection. So if you've got somebody who goes out on leave and they come back, you're going to want to be careful about how you handle this. You want to make sure that they don't have a reduction in seniority. They haven't had any loss of benefits. Don't avoid any sort of disciplinary action for them for a while, if at all possible. Just FYI, I'm also an employment attorney, so I am more cautious probably and nervous about things. Then there will be a poster from Oregon OSHA about all of these requirements. It's not done yet. I don't expect they'll have anything done until at least November 1st. I will tell you, they are not good at deadlines. They have been telling us when we were going to see draft rules, and it's always at least a day, sometimes 2 days late, usually comes late at night. It is what it is. So they obviously are not going to they're not going to enforce the requirement that we have a poster posted until they can give it to us. So you can distribute this electronically and post it wherever you generally post your workplace posters. If it's in the break room, put it there. If it's in the copy room, put it there. Just sort of make sure it's in that same area where you typically would put a poster. So employers are going to have to provide training. This is going to be generally on whatever policies you may have adopted, on the infection control plan, the exposure risk analysis, and it needs to be a training that allows employees to engage. Now, I think that they're going to let us do sort of recorded trainings with a Q&A function that can be interactive. We've also asked Oregon OSHA if they could just simply do the trainings, because everything we're going to put in our policies or our plans are all going to be in these OSHA rules. There are a variety of ways in which you can provide this training. They suggest you could do it through in a safety committee, a safety meeting, another type of meeting, or with a union rep. I strongly urge you to do this through a safety meeting or other meeting, and to never involve a union rep, because you potentially get in a situation where you are negotiating over labor contracts and you don't want to be there. So there have also been quite a few industry specific guidance. A lot of them are based off of the Oregon Health Authority guidance that we've all seen over the months. But the specific guidances that are in the appendix are for restaurants, retail stores, indoor and outdoor markets, personal service providers, construction operations, indoor and outdoor entertainment facilities, outdoor recreational organizations, transit agencies, collegiate, semi-professional and minor league sports, professional and Pac-12 sports, swimming pools, spa pools, and sports courts, fitness-related organizations, K through 12 institutions, early education providers, higher ed, veterinary clinics, fire service and EMS, law enforcement, and jails and custodial institutions. Of note, labor really wants a food processing and an agriculture additional guidance. To date, Oregon OSHA has declined to give that to them. But if you see any recent articles, AFL-CIO and other labor organizations are not happy. The rules for healthcare are pretty challenging, and the definition of healthcare is very broad. We're not talking just about hospitals. We're talking all sorts of different sorts of healthcare industries. I have some concerns for home care providers. I think smaller clinics, particularly rural small clinics, are going to really struggle with the various requirements in here. So one sort of win that we got in the latest draft for healthcare is that they made the distinction between employees who are healthcare employees and employees who happen to work in the healthcare industry but are not healthcare employees. So if you've got like accounting staff or something like that, they will not be subject to these requirements. So the next steps are, we have stakeholder meetings today and tomorrow. Today is the general workplace stakeholder meeting. We're going to provide our final feedback on these rules. And then on Friday is the healthcare industry feedback meeting. The division still plans to adopt the rules by October 21st and have them in effect by November 1st. And that is it for me, and I am happy to answer questions. And I'm going to stop sharing my screen now. I will send this over so you can have the actual PowerPoint.
Thank you so much. What I'll do is once our recording has been completed, we can post it up on the chamber website. And if anyone is interested in receiving the slideshow, just shoot me an email at president@mcminnville.org. Or maybe it would just be easier, Holly, if we just sent it out to everybody that was on the call today. If you want it, just let me know. I'll send it to you, okay? So we have some questions. My goodness, first of all, that's a lot of information to absorb. And there were a few things you said that I thought, so, you know, the chamber is a small office. There are 3 of us. Mm-hmm. It would be very hard for me to keep one of us getting sick from the other one.
Right.
Right.
I mean, and that circumstance, you're not revealing, if somebody happens to tell another person, that's fine.
Yeah.
You just don't want to sort of be revealing anything that might be protected health information.
Right. Well, we're in a little office. If one of us goes missing, the other two are going to know. Just
Yeah.
saying.
Yeah.
It's hard to keep that. So I could see this would be a very difficult situation for a small office in maintaining that confidentiality and holding, the HIPAA rules. But that's, HIPAA's just, HIPAA's there for a good reason, right? To protect people. Okay. So we do have some questions. So I'm going to go to the beginning here. Let's see. And if you do have a question, please pop it into the chat if I could figure out how to get it to work. Slides you're going to send. Yes, we will post it on the Chamber website. All right. So this is one question. Do these rules apply to schools which already have many special, bear with me, I can't read it now. Many specific rules and guidance issued by Oregon Department of Ed and OHA?
Yes. Initially, the division had said that they wouldn't need to apply to schools, but then various labor organizations got very upset and that didn't happen. So the general workplace rules apply to education, and the additional industry specific guidance for K through 12 education also applies to them.
Okay. That is good. Is the distancing officer no longer required? I thought I did hear that it was required, that someone needed to be responsible for that. And second, go ahead, finish that, and then we have a second question with this.
Yeah, in the current draft, in the latest draft, they took out any reference to a distancing officer. Now, I would say best practices, you have at least somebody who is in charge of making sure you've got all the signs up. If you've decided to do traffic flow, somebody who's sort of keeping an eye on that, but it's not a requirement in the current rules.
Okay. And will we receive a rough guideline to establish written exposure guidelines? So will OSHA be providing something like that?
Yes. So the rules themselves have a list of questions that they suggest you ask. And they will create a template that will essentially be those questions and space for you to answer them.
Got it. Okay. Next question. As OSHA, I assume, are set on approval of these rules by the 21st, will there be adjustments as time goes by? So as the world changes, we can expect further adjustments?
Unlikely that they will, because generally speaking, you can't adopt a new temporary rule. It's possible that they will revisit the rule, but more likely what we'll see is sort of rolling enforcement guidance that comes out from Oregon OSHA, which is a nightmare. But if any of you work in the retail field, you are accustomed to this already. So that is likely how we'll see it. We will launch almost immediately into permanent rulemaking, and the permanent rulemaking is where you're going to see most of those adjustments.
Got it. And, I had a conversation with someone recently, and we were talking about OSHA and how OSHA has really requires businesses. So, for example, I'm a business and I have a restaurant, and I hire somebody to come and clean the hood because, I have to do that every year or whatever. And their ladder is not properly adjusted. Then it becomes my responsibility as that restaurateur. Say OSHA walks in the door and says, hey, you can't have that. And I am the one that gets fined, not the business who carries the license and does all, and is supposed to be the professional in this. Is there any, this is totally off topic, but it is not, because at some point, the responsibilities on a business are just overwhelming. And
yeah,
how do we manage that as a business?
So OSHA has really been expanding in broadly interpreting their authority. In general, they only have authority over employers and employees. Now, how they have twisted this authority is that they have authority to ensure safe workplaces from all employers. And so they argue even if that person isn't your employee, because you are an employer of somebody, they can enforce against you. I think that is an overstatement of their authority. We will be revisiting several legislation options in the 2021 session to try and clarify the limits of their authority.
Okay, that's good to know. Thank you for that. Okay, there is a concern from a business that says, concern about state-run CARES program, employees fear in handling like the unemployment insurance, what ADA exceptions are going to be made. So I guess this question sounds like, the unemployment situation was a mess. So is the OSHA situation going to be equally as a mess as some of the other things that have happened this year because of this?
So the ADA issues have been a real struggle. I think the administrator for Oregon OSHA's belief is that he has the authority to do this. And he thinks it's sort of simpler than it is at the end of the day. People feel very strongly about wearing face coverings, and it caused some real difficulty. So I do think there is a good chance that we get a fairly good statement that comes out of BOLI that, an OSHA requirement about workplace safety that requires that you wear face masks means that that employer would have an undue hardship if somebody said, I have a disability and therefore I can't wear a mask. So you are exempt from providing the accommodation request if an undue hardship applies. So, but we're not there yet. I keep on arguing this, and I will keep on arguing it, and I won't stop. That's my promise to you.
Thank you. Thank you for that. Is it correct that there is no longer any language about barriers? I know I heard you say something about barriers because initially you could have barriers and that way you didn't have to wear a mask all day long, but my understanding is that has changed?
Yeah. So they had some really complex math and sort of ideas about what barriers would have to look like in the original draft. It would essentially be virtually floor to ceiling barriers. So we had a concern about that. They have told us that they would still have them in sort of an appendix. I haven't seen them yet. But barriers, I'm going to bring it up in the meeting this afternoon and sort of say, like, what do we do where we put up all these barriers? Is that no longer good enough? I think their answer is going to be everyone has to wear a mask.
Yeah. Okay. No matter what, even if they are 6 feet apart, or
no, if they are consistently 6 feet apart, then they wouldn't have to. But if any sort of work activity is going to bring them closer than 6 feet, I would say that they need to wear masks.
Okay. And this question about recommending handling those that insist they aren't required to wear a mask due to medical issues. So I think you've sort of answered that question. And
yeah, I mean, your best answer is, this isn't my choice. This is Oregon OSHA's choice. I'm required to make you wear a face covering of some sort.
Right.
We can figure out some workarounds, but that's the way it is.
Yeah. And my understanding is the CDC said wearing a face shield wasn't good enough.
Right. Right. I have flagged that for OSHA and said, you know, we've got a lot of employees who got accustomed to face shields.
Right.
And I think that you need to say, allow us some wiggle room on that.
Right. Yeah. Okay. Thank you. Another comment. It's about protecting wages for employees that have to quarantine. The employees need their wages now, not 6 weeks later. So that was the concern with unemployment. So if somebody had to go on for a health reason, that they would have to quarantine, and how would they get their wages? So we're waiting to hear from Boley on that, correct?
It's actually a different division within the Department of Consumer and Business Services. Now, they've said it shouldn't be that long of a wait, but I don't know how they're processing them. Yeah.
Wow. Well, okay. No comment. How do you see the enforcement working after these rules are adopted? Will they only work on complaints, or will there be OSHA spot checks? So my understanding is OSHA walks in your door, somebody files a complaint, OSHA walks in the door, and they write you up for something, and you have to pay a fee no matter what. I thought they were also doing education so that they didn't have to start finding people.
So there's a couple different things on that. So one, you can ask Oregon OSHA for consultation services. They provide free consultation services, and right now they're doing them sort of virtually. It's also a little bit, it's a safe place to be. So while you're in consultation services with them, they can't assess any penalties against you. So there's that piece. Now, the other piece is they've definitely spread the information about how to complain. They've gotten more complaints in the past 6 months than they have ever gotten in several years combined. So you're going to get, unions are going to complain, employees, visitors, you're going to get more complaints than you would normally have gotten. Right. Usually, once OSHA gets a complaint, they'll contact you and say, we received this complaint saying you aren't enforcing the face covering requirement, or workers are routinely working closer than 6 feet. You have 7 days to respond to that. Respond. Even if it's to say, no, that's not true, here's our policy, or here's what we're doing to ensure distancing. So respond to what the complaint was about, respond within 7 days. There's always a chance they're still going to come and do an inspection, but they may not. If they feel like your response is sufficient or that you have the proper procedures in place, do that. My advice also, so I work very closely with a lot of retailers, sort of overdo it on your signage. Should OSHA come to your office, you want to make sure that you've got as many signs. I recommend using the OHA signs, even though you could have information that says exactly the same thing. I think it makes them feel better if you're using the OHA signs. And then if they cite you, you usually have some room, some back and forth, but you're likely to get a penalty of some sort. The penalties, the low end is around $200. The high end is, for really egregious situations, can get over 100,000. Now, an egregious situation is like Michael Wood's favorite example is the hairdresser in Salem who continued to operate after the shutdown order. And then when OSHA inspectors came to her workplace, she met them with armed guards. That could get you a hefty penalty. And in that case, she got a $20,000 penalty. But that's an exceptional circumstance.
Right. Wow. Yikes. That's a lot of money. It's a lot of cabbages, they say. Right? Wow. Okay. Thank you. Next question. Did I understand correctly that an employer is not required to provide paid sick leave to an employee who is asked to quarantine? They can use their own PTO if they have some available or it's unpaid.
Correct. So if you have paid, if that employee still has sick leave available, but you don't have to provide them new sick leave. Now, while you are currently, we're until December 31st, we are still under the federal legislation, the Federal Coronavirus Relief Act, or the Families First Coronavirus Relief Act. If you are subject to that law and that employee hasn't used the 2 weeks that they were entitled to under that, you need to provide them with those 2 weeks. But it's not, there's nothing additional above and beyond the federal legislation.
Okay, good. Those questions earlier about the CARES Act versus ADA, I'm not sure I understand. It was supposed to be 2 separate questions, it says here, on CARES Act versus ADA. Do you feel like you've answered that or not?
I wonder if maybe it's the leave requirements. So CARES Act requires leave related to quarantine, and also expanded unemployment insurance to allow employees to use unemployment insurance for quarantine purposes.
Right.
And then the Oregon legislature used CARES funds to create this new quarantine time loss program.
Got it.
In some circumstances, the ADA can require that employers provide leave. So that's if you have an employee who is asking for leave related to a disability that's not sort of covered in some other way, I guess I would say contact your friendly local employment lawyer, because that can get messy, and I can't really sort of speak to every possibility on that one.
Right. Okay. That's good. Thank you. Is there language about what constitutes a face mask? Well, we talked about face, visors or face shields. Those don't constitute a face mask, correct?
Yes, there are detailed definitions about what is a face covering or a face mask in the rules. They're consistent with the OHA definitions that have been out there for a while. Let me see if I can quickly find it. Okay. A face covering means a cloth, polypropylene, paper, or other covering that covers the nose and the mouth and the rest snugly above the nose, below the mouth, and on the sides of the face. Basically what we've all gotten used to. A covering that incorporates a valve that is designed to facilitate easy exhalation, or mesh masks or other covers with openings, holes, visible gaps in the designer material, or vents are not appropriate face covering because they allow droplets to be released from the mask. Different requirements if we're talking about respirators, so
Right.
different volume.
Right.
There's also a definition for a face shield, which is has to cover the forehead and extend below the chin and around the sides of the face. And then there is a definition for mask, which is FDA cleared surgical, medical procedure, dental, or isolation masks. Masks are medical grade masks that function as a physical barrier to protect workers from hazards such as splashes of large droplets, blah, 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 blah. So you may have masks that are called masks on your packaging. They are face coverings. So even if they aren't considered FDA approved or surgical masks, they're still considered face coverings. Oh, I have gotten that question a couple times.
Thank you for explaining all of that. There's so many details, and they're very specific and hard to wrap all of our heads around. Another question. Currently, we say there, in quotes, there is not an accommodation for not wearing a mask by the state and federal agencies. Is this still accurate?
Yes.
Okay. Thank you. Do we have to have a written policy in our handbooks as well as updated employee signatures of the policy? That's a really good question. That's something I hadn't thought.
So I would say that you want this separate from your employee handbook. I would, if you're going to sort of adopt a new policy that's separate from your exposure risk analysis and your infection control plan, then I would say you want to write it all down in a single policy and then distribute it to employees. Yeah. Particularly in light of the fact that you've probably got a number of employees that are working from home. I would recommend distributing it electronically. You could ask for it to be signed, but the most important part is that you can show, one, that you did it, and two, that you distributed it and who you distributed it to. So email's going to work. You're going to have those records.
You could probably maybe get a read receipt. So
yeah.
Then you have proof that they actually received it. Okay,
yeah.
That's good. There's a question about greeters, which is our Friday morning meeting, our networking meeting. We've been doing a lot virtually, but we have met in person. So the question is, so if, for example, during a greeters type of event, people take their masks off and someone complains to OSHA, is it the host who is responsible? So the chamber runs the event, but it is a chamber member that hosts. So who's responsible? We've met outdoors. If you're outdoors and you're 6 feet apart, that's okay, right? You don't have to have a mask on, or do you? I don't know. It's not clear.
So in all likelihood, it's whoever is hosting it. So if there was a complaint, it would likely be against the person whose building it is, because they also have requirements for building operators. Right. Outdoors events, they've been reasonably flexible about. But I think, if you have an outdoor event where people are routinely coming closer than 6 feet and not wearing masks, that's probably going to be a problem.
Okay. Yeah. All right. That's good to know. Do we ask about waivers? So what about having people sign a waiver that I don't want to wear a mask, and where are we with that? I mean, is it legal?
So a couple things on waivers. So one, waivers are virtually unenforceable against employees. May or may not be enforceable for others. I think Oregon OSHA would say, no, that doesn't work. You need people, because their concern is not the person who doesn't want to wear the face covering. Their concern is the other people in the workplace. And they're going to say, well, you are now creating an unsafe workplace because you're allowing this person not to wear a face covering. If you're talking sort of events, I wouldn't recommend it.
You would not?
I would not recommend waivers.
Okay, good to know.
I think they give a false sense of security.
Okay, good. Let me see if there are any more questions. In regards to temperature taking, do we have to take temps for every person that comes into the office?
They haven't, the rules don't specifically address temperature taking. I think you'd want to make sure that you have sort of a really consistent policy about how you do it. If you're going to do temperature taking for everyone who comes into your business, then it really needs to be everyone. You want to make sure that you are keeping records, that those records are securely maintained, that sort of. So you just want to be very careful about how you do it and make sure you've got a solid policy and procedure about how you handle that.
Wow. It is 1:56 or roughly 1:53 rather, sorry. I've got a clock over there that has the wrong time. Oh, wait a minute. Do we have to take temperatures for all of our employees as well as a log that can be handed to OSHA if we get cited, as well as is there a specific rule on the temperatures and how to log it?
So there's nothing specific to temperatures right now. There are some specific rules about testing and how you would have a procedure for notification for employees if employees say that they have symptoms. But it's generally employer must create a policy and procedure. There are provisions in the rules about if the health authority or public health agency wants to do testing on site, but that's really more about testing than temperatures.
Right. Okay.
A lot of the health officials have stepped away from temperature taking because it's not necessarily the best guide of whether or not somebody is infectious or not.
Right, because you can be infectious before you become, before you actually have a temperature with anywhere from 2 to 5 to 7 days. I mean, it can be quite a long time that that you're infectious. Okay. Since the list of symptoms is growing, if an employee is exhibiting any singular symptom, how long should they be symptom-free before they are allowed back into the workplace?
It's two ways to do this, or a number of ways. One, I would probably, best practices, if it was my business and I had an employee who said, you know, I think I've got a symptom, I'm not sure, I would say, go get a test. If you need it, if you need us to do it, we'll pay for it. And now, that's not a requirement. I'm not saying that everybody needs to do it, but that's probably what I would do. I would require them to get a medical note from a doctor that says this person's fine to come back to work.
Right.
So those are sort of, you'd want either sort of a reliable negative test, a doctor that says they're safe to come back to work, or if they were ordered to isolate or quarantine by a public health official, whatever that time period is that the public health official said that they should be quarantining for.
That's good. Are we still required to keep records for contact tracing? So we have greeters on a Friday and we are outside and we make sure we have everybody's name. We're still required to keep those records?
It's a recommendation, not a requirement. And that's not in the OSHA rules. Right. It's in previous health authority guidance and I think governor's executive order.
Okay. Oh my goodness. I don't see any other questions coming through. Anyone else before we thank Paloma and her expertise and really all of her hard work on this? It's a lot to absorb. It's a lot for our businesses to understand, and we really appreciate you coming here today and doing all of this work because you got this information late on Tuesday. So thank you.
Yeah, just a quick pitch for what we're doing. So OBI is going to do a webinar on October 29th with attorneys from Tonkintorp to go to do sort of a general overview about what the rules are, what you should do, best practices. So those will be like regular, real practicing lawyers. I know a lot about employment law, but I'm generally a lobbyist slash run my own organization now. So that may be really useful. And my understanding is that we're planning to make that free and available to not only OBI members, but all of our chamber partners.
Great, thank you.
Mhm.
That'd be great. When I see it come across, I'll make sure I put it up on our calendar, and we'll put it in one of our emails to everybody. The 29th is not next week, but the week after. So I'm sure, I do recall seeing something about that, so I'll make sure we get that out to everybody. Seeing no other questions, thank you, Paloma, for your time today. Great job, and really appreciate your expertise. And thank you, everyone else, for attending today. We will post this once Paloma sends me the slides. Excuse me, and we'll post this up on our chamber website. Thank you, everyone. Stay well, and call us if there's something we can help for you. Send me an email if you need anything. Have a great day. Thank you, everybody.
Hey guys, good to see y'all.
Thank you.
Bye, Paloma. Thank you so
Bye.
much. You were great.